Welcome to today's webinar, The Impact of COVID-19 on Women and Women's Rights in Latin America, here at the Nordic Institute of Latin American Studies at Stockholm University. So we are pleased to see that the interest is very high. We have currently more than 1,000 registered participants representing various stakeholders, groups, governments, NGOs, civil society here in the Nordic countries, in Europe, and of course in Latin America. My name is Kristina Alnevall, and I have organized this webinar and will moderate the event. So the COVID-19 outbreak is impacting societies around the world. However, not everyone in every place will be affected in the same way. Given that COVID-19 crisis affect women and men in different ways, measures to resolve this crisis must take gender into account. This pandemic crisis has thrown gender-based differences into a sharper position. Governments, multilateral organizations, and international institutions need to take women into consideration when resolving the crisis. For example, women and girls are particularly at risk in this current crisis. Experience shows that domestic and sexual and gender-based violence is increasing during crisis and disasters. There is a shadow pandemic of violence against women and girls surging in the wake of COVID-19 crisis. The focus of this webinar is on women and women's rights during the crisis, but also the post-corona situation. The panel today consists of highly qualified professionals with long experience in these questions. We have with us today Michelle Bachelet, who is the United Nations High Commissioner for Human Rights. She also served as the President of Chile in 2 occasions, and she has also been Health Minister and Latin America's first female Defense Minister. She has also worked in the UN Women as the first director, and she has a long experience in these questions in Latin America. We also have Margot Wallström, who is a Swedish Social Democratic Party politician and a diplomat. She has been the Swedish Minister of Foreign Affairs, and she has also served as a European Commissioner for the Environment. And she was also the first Vice President of the European Commission. She also served as the special representative of the UN Secretary General's special representative on sexual violence and in conflicts. We also have Nadine Gassman, who is the president of Muchas in Mexico. She is a medical doctor and holds a PhD in public health. And she has served as an international officer at UN Women in Brazil and also in Guatemala. She also worked as the head of the Secretary General campaign, Unite to End the Violence Against Women in Latin America and the Caribbean. And we also have Marieke Bluefield, who is the director of the Institute of Latin American Studies at GIGA in Hamburg. She is also a professor of political science, and was prior to this professor of political science in the University of Miami. Marike Bluefield has also written on the COVID crisis, and among other things, she wrote this one together with Fernando Figuera just in April this year. So, this event will be as the following. I will first give the word or the screen to Margot Wallström, and then to Michelle Bachelet, and after that Nadine Gassman. And Marike Bluefield will give comments on the presentations. After that, there will be possibilities for the audience to ask questions, which we, the moderators, will select, because I think there will be a lot of questions. So we will also finalize the webinar with some words from our director, Andres Rivarola. So that was a long introduction because you have such a great CVs. So please, Margot Wallström, the screen is yours.
Thank you very much. Thank you for inviting me. And of course, it's an honor and a pleasure to share this virtual podium with people like Michelle Bachelet and of course Nadine Gassman, and Marike also. Thank you for then commenting on what we have to say. Thank you, Christina. Well, first of all, let's take a minute or a moment to think of all the victims of this pandemic. Millions of people being infected around the globe, and so many deaths already. It seems to me that from a medical point of view, that COVID-19 discriminates. It actually targets more men than women, as it seems. And if I'm correct, I mean, we have two doctors here on the podium, so maybe you can correct me if I'm wrong, but that's how it has been reported. And also more older persons than young. But it is for sure global. It knows no national borders, and it kills as effectively in one country as in another. In a broader political perspective, this pandemic has already shown us our vulnerability, our interdependence, our fragile democracies, and the cost of ignoring environmental and climate change warnings to our world. So, to women, as is the theme of our webinar today. They are, of course, also some of them victims, but they are also daughters, sisters, wives, mothers themselves affected by COVID-19. And it seems that so many of the fallout effects, if I can call it that, of the pandemic is affecting women. Because women are also very brave health workers. They are brilliant scientists. They are bold leaders at all levels. They are bound to take often unpaid care of old parents or children. And I read that in Somalia, for example, women now head about half of all the households. They generate 70% of household income, and they shoulder most of the responsibility of caring for the sick. That's how the situation looks in many countries. Women are caregivers, but also frontline responders. As I read also about Rohingyas in the camps now producing face masks, or all the women doing homeschooling, or those that actually plow the fields of the neighbor because they are all ill with COVID-19, and they help them to grow their potatoes and sell them. So they also take all of these initiatives to show solidarity and to help others. Now, the problem is also that women disproportionately work in the informal economy, and that means that they have no protection when they are sick or when they lose income. So they have more precarious jobs in areas affected by the lockdown, for example. Tourism, travel, restaurants, all of those sectors employ a lot of women. Women globally have lower literacy rates and access to technology. So it has become more difficult in many places to provide them with information and help them also from that point of view. So when health systems are overstretched, then there is a risk also for women giving birth, and with sexual and reproductive health services being provided as well. And as I guess will be part of our conversation today, the fact that violence against women and children has been exacerbated during the crisis. And I learned from UN Women statistics that in Argentina, as an example, domestic violence has increased, or the calls to report domestic violence has increased by 25%. But this is unfortunately an experience that we share so many countries around the world. We have learned that this is something that has not been fought down during the crisis. And I heard, Christina, you called it a kind of shadow pandemic, and that seems to be a proper name to it. And just imagine how many women that have been locked in with violent partners or husbands, and the difficulty that they have experienced. So the picture is both one of all of these problems that we can see, and where it seems that women, they have to carry that unproportionate burden of the effects of the pandemic and the virus. And at the same time, they do all of these amazing things and take so much of responsibility, also as the frontline workers in healthcare and in other professions that really also take care of the effects of the pandemic. Where does this lead us, and what do we have to do? Well, it seems clear that societies also with very big inequalities and differences and gaps between groups of people will, I think, experience a much bigger problem. Also when this pandemic hopefully one day is over. And it is very important to realize the role of women, and I would say to defend democracy, and that is of course part of that. I think governments already have to realize that they have to allocate money, provide budgets to meet women's needs. They have to make sure that bailout or stimulus packages also take women's needs into account, and that they include social protection measures. Everywhere, women have to be included in decision making, in the analysis and the decisions on how to move from here. And we have to make sure that we get rid of some of the stereotypes when it comes to roles in households. It is not only for women to do homeschooling or cook and take care of all the household chores when a crisis locks us in. And I think that these areas that I've touched briefly on, the economy, where women then end up in more precarious jobs and have bigger difficulty in actually getting paid, the health and safety sector, the way they are exposed as health care workers and in decision making, they are areas that we really have to take seriously. And the other day I heard somebody saying that, oh, there are so many floskels now being traded. We know that the UN has a motto of building back better, and we see all these ambitious proposals. And she said, I think only poets and maybe musicians should be allowed to say anything about how we build back societies. But I really think we have to turn to the very practical and political programs and make sure that also everything is done now, for example, to help all of these women that are exposed to domestic violence. And you have to make sure that that women can make emergency calls. You have to make sure that there are shelters for women and children. You have to make sure that there is healthcare and that there is a full understanding of what this does to an individual woman and her family and her children, but also to a whole society if we see this being exacerbated during such a serious crisis as a pandemic. So these are the things that I would like to say as food for thought and maybe for our discussion here today. I think we share so many of these things from country to country. Those experiences will be recognized in many countries, and we have to both provide hope and encouragement for everything that women do and carry out every day, as well as being very clear-eyed about the problems and all the reforms that are necessary for the future to be able to overcome also some of the discrimination and the problems that we see for women. And of course, you are better placed to describe the situation where you come from and where you are. But I think that these are some generalities that hopefully can serve as some food for thought. So thank you.
Thank you very much, Margot. I think I will directly give the screen to Michelle Bachelet. Welcome.
Thank you, Christine. And of course, it's great to be with Margot and Nadine. I'm not going to say old friends because old is a word we don't like, but long-term friends and long-term in the same battles. So I'm very happy, and also with Marike. Well, thank you so much for this opportunity to address you today on a topic that I really care deeply. And at this time, none of us will ever be able to forget. First of all, I sincerely hope all of you, your loved ones are well and safe during this very difficult moment. For months now, the COVID-19 pandemic has been challenging our societies, our governments, and ourselves, testing our leadership and humanity, if I would say, and disrupting, as you said, Christine, the lives and livelihoods of billions of people on the planet. And overcoming the pandemic will continue to demand decisive, coordinated, and innovative action from all, but also for all. And this, I think, will be a big challenge. And I think this is a human crisis, and as such, response and recovery efforts will only be effective with human rights front and center. We now find ourselves at a complicated period with some countries reopening after lockdowns and others still with soaring infections and death rates. Subsequent waves of COVID-19 are likely to occur in different places at different times and with different degrees of severity. So it is vital to ensure that the response leaves no one behind, because the health and well-being of everyone depends on it. Indeed, while the virus itself does not discriminate, I mean, the virus infects everyone. Infects women and men the same, but the impacts do discriminate. The uneven impacts have laid bare the social and economic inequalities on which it feeds. I mean, for me, inequality is the reason why I started participating in politics. So for me, this is not something new, but I think it has shown so clearly the importance of inequalities. The overall consequences on lives and economies is clearly catastrophic. I mean, all the estimations on which will be the social and economic impacts are devastating, with the poorest, of course, the most marginalized and most vulnerable being affected worst of all. So women and girls, for example, are at high risk, not due to any inherent vulnerability, but rather to pre-existing discrimination and inequality. In Latin America, this is particularly evident for women working in the informal sector, domestic workers, indigenous, Afro-descendant, women with disabilities, older women, migrants, women with HIV, or those of diverse sexual orientation and gender identity. So let us be clear, to better protect all, the response to COVID-19 should consider gender-specific experiences and needs. Well, dear friends, there are different ways in which the COVID-19 pandemic is affecting women's rights in Latin America. One of the most disturbing is that, like in past health emergencies, the current crisis has been accompanied by a surge in gender-based violence that Margot was talking about. This has been reported around the world, especially in places where quarantines, self-isolation, and other restrictive measures have been adopted. For victims, access to support can be difficult due to confinement with the abuser, or because such services also risk becoming less available. In many countries, they have shut down the shelters. They have not considered the centers for victims of violence, gender-based violence as essential. In some others, they have that, but in some others, not. So for them, it's very difficult. And the situation has been no different in Latin America, a region where the levels of gender-based violence, including femicide, are among the highest in the world. And my office has received a concerning report. In Brazil, the government informed a 35% increase of gender-based violence reported in April compared to the previous year. In the same period, calls to a service hotline in Argentina have increased by 39%. In Chile, the reported increase was of 70% during the first weekend under quarantine. In Mexico, and Nadine can correct me if I'm wrong, reports indicate a rise of 60% from February to March. In the region, civil society organization estimates almost 300 cases of femicide during the quarantine. And as I have mentioned in previous occasions, support services should be declared essential and remain open at all times, even during lockdown. Accessible systems to alert authorities and protect victims should be put in place, and victims should be informed about available services. It is encouraging to see practices in this direction being reported in the region. Many countries, including Brazil, establish hotlines or helplines. Bolivia, Costa Rica, and Mexico launch information campaigns on support and assistance services. Peru opened new shelters to welcome women in need for protection. In Chile and Argentina, a code word was established to help victims seek help in pharmacy. So they can go to a pharmacy and ask, for example, do you have a red surgical mask? And that is a code that they need help and they need support. And in Uruguay, the Supreme Court automatically extended protection orders that were expiring. So I welcome this example among others. But the full impact of COVID-19 on global and national economies has yet to be felt. But according to a report by the Economic Commission for Latin America and the Caribbean, ECLAC, the pandemic will lead to the biggest contraction in economic activity in the history of the region, a minus 5.3% drop in 2020. And this situation will impact all, but once again, women will be especially affected. In most Latin American countries, women are highly concentrated in the low wage and informal sectors. Almost 40% of women working in the region are employed in those kind of areas that have been affected by the COVID-19, commerce, restaurant, hotels, domestic work, tourism. In Bolivia, Guatemala, and Peru, for example, 83% of women are employed in the informal sector with no social protection. Indigenous women are disproportionately represented in the informal economy. So their access to livelihood is at risk and the threat of hunger becoming very real. In addition, they face barriers to access healthcare and information. Living in rural areas, for example, many indigenous and Afro-descendant women have no access to internet, electricity, or public transportation, and many don't have access to water. So we tell people wash your hands, but they don't have access to water, neither sanitation. I think there's 31 million people in Latin America without access to water, to clean water. My office has also received reports about the limited availability of health-related information in indigenous languages. So this situation is particularly affecting older people because many of them don't have either pension, neither social protection schemes. Moreover, women in Latin America perform 73% of unpaid care work. With the closing of schools, they have been under additional stress with risk for their health and well-being. In the region, they also represent half of medical personnel and more than 80% of nurses, the highest percentage in the world. And as caretakers at home and hospitals, women are disproportionately at risk of infection. Furthermore, overloaded health systems, reallocation of resources, and shortages of medical items could undermine the sexual and reproductive health and rights of women and girls. For example, I have received reports from Honduras on the negative impact of the epidemic on prenatal and postnatal care. In countries like Guatemala, indigenous midwives who play a crucial role in their communities were reportedly lacking basic products to combat COVID-19, such as alcohol, gel, and soap. So, although the challenges posed by COVID-19 in Latin America are indeed grave, we see several promising practices coming from the region. For example, to address the economic impact of the pandemic, the authorities in Costa Rica have taken measures to protect labor rights of women and reduce credits obligation for projects including youth, women, indigenous, Afro-descent, peasants, migrants, older people, and those with disabilities. In Bolivia, the government granted special leave permits to protect salaries of certain groups, including pregnant women and single parents with children under 5 years old. And my office has been supporting several response efforts in different countries in the region. Some examples include providing technical support to civil society organizations and state institutions that work for the legal defense of women deprived of liberty in El Salvador, working with indigenous authorities and women organizations in coordination with the government to facilitate access to healthcare information in Panama, launching the social media campaign #Mujeres y COVID-19 in Guatemala, which provides a platform to women experts, activists, and others to voice their reflections and concern, providing capacity building for national helpline for victims of gender-based violence in Argentina, establishing a network of women human rights lawyers in Mexico, which is assisting on gender-based violence cases and providing advice to local victims commissions. We will soon be organizing a series of webinars to promote a reflection among authorities and civil society on the impact of measures taken and remaining gaps. Supporting the government-led campaign that is telling every woman in Costa Rica, #No estás solas or you're not alone. So indeed, this is a moment none of us should be alone. We may be physically distant today, but we must stand close together. The time is for deep global solidarity. The Secretary General, my office, and other United Nations agencies and entities have been actively providing guidance to response and recovery efforts. It is essential to ensure that people are part of the decision that will impact their lives. And I have repeatedly stressed, like Margot was saying, the importance of women participation in the design and implementation of COVID-19 responses, because the situation is not the same. And also, women are not the same. It's different to be an urban, professional woman living in a good house than to be a woman who lives in a poor neighborhood or in a rural area. So unfortunately, in Latin America, as around the world, women continue to be underrepresented in decision-making processes. And my office has also provided detailed guidance on specific measures that states can take to ensure that the rights of all women and girls are protected during the crisis. These include ensuring women health workers have adequate access to personal protective equipment, guaranteeing that medical care is available and accessible by all women, including sexual and reproductive health services, promoting equal caregiving responsibilities and supporting families with children, and as I mentioned earlier, declaring gender-based violence services as essential. We have also stressed the critical importance of gender-sensitive economic incentive and social safety nets that should reach and empower every woman and every girl. And finally, we must not lose sight that recovering from this pandemic, as we will, brings a remarkable opportunity to build back better. So I think we must seize this opportunity. And to make it happen, women must be equal part of the conversation. We need more women in decision-making positions, including in healthcare. It is troubling that while women are 70% of the health care force globally, they are less than 30% of CEOs and health board chairs worldwide. As I mentioned, women has been strikingly absent or underrepresented in the majority of national leadership teams responding to COVID-19. Consultation with women's groups and feminist movement should be an obvious measure in any crisis, not an afterthought. And in the recovery, individuals, and particularly women, must be placed over corporate profit. Economic policies must better value women's contributions, both paid and unpaid labor and caretaking, and prioritize health, social services, and education, sectors that have huge participation of women. They should also facilitate the progressive transition of millions of workers, the majority of whom are women, to the formal economy and invest in public childcare. In some, economic recovery should be focused on the most affected and have a feminist vocation. And I have to say, because for some time I've been seeing all these protests on the streets for many reasons in many different countries. We should take this opportunity to look at the economic system. The economic system that we have now is not working. It's not making life better for people. It's not ensuring welfare, and society as well, and political institutions as well. So we need to think on how we really build back better. A couple of weeks ago, the Feminist Economic Recovery Plan put forth by the Commission of the Status of the Women in the state of Hawaii in the United States made the highlights. The plan includes call for a universal basic income, to countering the wage-gender gap, for essential workers to have access to free childcare, for a minimum hourly wage for single mothers, for the creation of public emergency funds available for high-risk groups, like undocumented women, and for the reinvestment in midwifery services. These are interesting proposals, which I hope we will be seeing more and more. Stimulus packages should also support the transition to a healthier, resource-efficient, green, and circular economy. As a medical doctor, I know that all these terrible things that we have had, SARS, MERS, Ebola, and now COVID-19, are zoonoses. They are diseases that come from animals to human beings. So we need to take better care of the nature and respect biodiversity. So climate action must be decisive and ambitious, with positive impacts on health of all people and of our planet. And let us not forget that women can have crucial roles in climate change mitigation and adaptation. Agriculture, for example, is not only one of the most climate sensitive industry, but also essential to respond to food insecurity that will be worsened by the pandemic. Recovery efforts should actively support women farmers' transition to a climate smart and sustainable agriculture, while at the same time help remove barriers they face, such as unequal access to land, information, technology, and other production and financial resources. In conclusion, gender equality is not an option, nor can it be cast aside in times of crisis. It is essential to peaceful, just, and resilient societies, as recognized by the 2030 Agenda for Sustainable Development. Ignoring this would not only be counterproductive, but unprincipled, betraying the fundamental promises every country has made to its people. I will also mean failing on our duty and moral imperative to build back better. So I'm confident that it's possible to achieve this objective if we are mindful of our independence, of our equality, and of our equal rights. And if we are mindful that the world needs to work together in a collaborative, coordinated way, and that's why multilateralism is so important. So we are all counting on you. Great to be here with you. Thank you.
Thank you very much, Michelle Bachelet. I just want to remind the audience that you can ask questions in the chat. You find the chat at the bottom of the screen, and we will select some questions after the presentations. So, but before that, I would like to give the word to Nadine Gassman. Welcome.
Thank you very much. It's really an honor to be here with you. And I, as everybody, hope that everybody that's in the audience is fine, is healthy, is taking care of themselves and their families. I really greet with affection the women I really are recognized as inspiration in the struggle for women's human rights and essential to build a better and equal world. For me, President Michelle Bachelet, the High Commissioner, Margot Wallström, Christina, thank you very much for the invitation. Marike, thank you very much also for your comments. I'm really glad that this virtual conference among allied countries with which we share many agenda items, including the commitment to the Generation Equality Forum, which would have been in May in Mexico, which is, as you know, a global process convened by UN Women and co-chaired by France and Mexico. And the Generation Equality Forum was central and is central because we are just postponing it to discuss how to accelerate change, how to make gender equality a reality for women around the world. And we share with Sweden the leadership with other countries of a coalition for economic justice. It's so important that we put at the center justice in every aspect for what we do. This panel of leaders like yourself proved the importance of participation of women in decision-making processes. I am really honored to be part of this relevant conversation. This pandemic has showed us that having female leadership changes the approach to a problem, brings innovative solutions, and brings other tools to the discussion, to policy making, to decision making, which have proved that they are very useful. You know, what has happened in the few countries where women leaders is very impressive in terms of how it has been approached and what the results have been. If there's something we had learned in this pandemic is the importance of the government fulfillment of new roles, how it is important to bring back the idea, which is not new for Sweden, but which has been left out in many countries in Latin America, of having protective states, where the center of the policies are people, caring for those that are in the most vulnerable situations. And that's what we are doing now in Mexico. So I will talk from our experience on how the government of Mexico is addressing the big challenges the pandemic comes. In March, before this started, the streets of Mexico were filled with women that were asking for the things that we are seeing now as essential. End violence against women, distribute care, and integrate women in the formal economy. These demands are proven to be a priority now. Although women are not anymore in the streets because they're at home, what is at stake and what has become part of daily life is exactly that. How we share care, and as you all have said, women are in the front line of the care taking in Mexico too. 80% of the nurses are women, 34% of the doctors are women, and they struggle also with going back home and taking care of their families and their communities. The feminist movement has shown what we are seeing now and living, and I think it's an unprecedented situation in the world, that every person is thinking and needing and having to address care as central to the well-being. This thing that feminists have said for more than 30 years that we are supporting the economy, we're supporting life in more than one way, is something that everybody is living at this moment. In some parts of our region, the COVID pandemic has resulted in losing freedoms and also the emergence of conservative discourses. This is a time to protect every advance and every achievement in women's rights. The crisis can be used by conservative movement to jeopardize the advancement of women's rights regarding freedoms, the full exercise of sexual and reproductive rights. Also, what we have seen at this time is how now that we have a digitalized world where everything is being done this way, there is a big gap between women and men, but also among rural women, indigenous women, in their capacity to access information, etc. So closing, as High Commissioner Bachelet says, the inequality gaps is essential for the development of, and one of the best strategies to stop violence against women and girls. For the Mexican government, human rights are a priority, and we're committed to guarantee them in every circumstance, especially during the pandemic. Mexico has declared it will not stop providing full support to victims of human rights violations, and all institutions to continue to work to defend the rights. In fact, very early in the epidemic, the Ministry of the Interior developed guidelines to protect human rights during the pandemic, to ensure universal access to medical attention, protect labor rights, the right for food and water, to create adequate conditions for homeless persons, to prevent discrimination and violence, access, culture, and education. And of course, to protect women who are at risk of suffering violence at home. The pandemic, as you had very rightly said, did not create the inequalities. It just revealed them. And I think it's very important that what we are seeing now is that all those things that were there before the pandemic are becoming more visible, more acute, more important, and make them more urgent to be addressed. From the high proportion of women that work in the informal sector in Mexico, more than 60%, the low proportion that are in the formal sector, to violence against women that we had six out of 10 women suffering, and we have 10 women being murdered per day, as well as access to education and services. So what are we doing? As you know, since December 2018, a new government, new administration was elected by the majority of the Mexican, and the President López Obrador government has put democracy, justice, equality, well-being, honesty, and government savings at the center of the National Development Plan. Protection of human rights is central, and investing in the poor through social programs is the priority of the government. And of course, this is very important for women and girls. The idea, the aim is to leave no one behind and no one outside. Parity has also been important in this administration. We have parity in cabinet for the first time in the history of Mexico. We have a legislation, both Senate and deputies are parity. We have a legislator with parity as well in the states. And this has shown to work. You know, I say what we're seeing now in Mexico is parity at work. You see it in the kind of legislators that is passed, the way the social programs are developed. We are committed to build a welfare government for the well-being of the population, with the emphasis of serving the poor, where women and girls are unfortunately the majority. And in the way we are addressing the pandemic, the president has made it very clear that there will be no repression, no restrictive measure to be enforced, such as curfews, and that the police will not be used to ensure the complement of the mitigation measures, as it has happened in our region. We have maintained the principles of the program, and we are putting attention to the poor. So the measures that being put forward in terms of the economy are both to strengthen the social programs and to create credits that can reactivate the economy, but small credits to the entrepreneurs, to people that have lost their jobs, etc. With this strategy, it's planned to have about 4 million people and families reached, which means to address about the needs about 70% of the population. In terms, there's a lot of things that could be told about the programs to support elderly, to support the young people, to support women, etc. But for time being, I would leave it into that. Also, what has been very important in this pandemic is the emphasis in providing full, transparent information on a daily basis, not just about the pandemic, but also about the programs that are being implemented. In terms of violence against women, yes, we have been very concerned from the beginning of the pandemic about the increase of already high numbers of violence against women. From the beginning, the services to address violence against women as shelters, care centers, etc., had been declared essential services, and we have strengthened the interministerial work to support the care system. We have made public, on one hand, a call for men to involve themselves and change and think about what is their role in society as they are at home. On the other hand, we have told women that they're not alone, that there is a hotline that we have strengthened. There are services, referral services that have become more innovative and have brought all this technology at the state levels, and we have really worked to promote that people can call, and that once they're called, they can be addressed. We're working, as our colleagues in Argentina and in Chile, in ways to create safe spaces, both in pharmacies and supermarkets. So at the international level, we strongly believe that it's a time to collaborate between countries. We need to use our experiences to really protect women's human rights, also to put an important stress in women human rights defenders that are caring for life, are caring for peace, human rights, and the territories, and which these times are difficult times all around the world, but very special in our region. We need a global response based in unity, solidarity, and renewed multilateral cooperation. Multilateralism is very important, has always been very important, but it's even more important at this time. And that's why Mexico has took an important proposal to the United Nations to ensure that whatever that health medicines, vaccines, medical equipment is warranted in the face of COVID-19 crisis, based on the promise that equally available and that the market doesn't work to make what it does better, which is to discriminate, and to ensure that we have equitable access to medical devices and that become a priorities. In times of difficulty, what saved us, and we know it from our history of fights in the streets, but also in government, are alliances and collective work. It's very important to identify joint responses to common challenges, the strengthening of effective multilateralism and rule-based international order, democracy, and international cooperation, in which the human factor has a crucial role. The conviction to work together is found precisely in the idea of the feminist foreign policy. And here I want to take the opportunity to recognize Margot Wallström, because these policies put social justice at the center with a critical perspective which recognizes and seeks rights of women and all people. And we in Mexico are in this administration building also our feminist foreign policy. And we are in the beginning, but we are sure that it makes already a difference in looking at the problems, in addressing our relationship. And finally, I want to talk about the future, the new normal, which shouldn't be the old normal, because the old normal wasn't very good for women, should be a fairer, more supportive, have a more local outlook, which rethinks the roles of women and men in every aspect of our life, as well as the role of families, the states, and the market. We have to question the prevailing global economic system, which is not working. And as it has been said, it's not working for people, and it's not working also for the environment. We need to strengthen our networks and consider solidarity. In Mexico, it has been to propose that we rethink the way which the well-being of the population and development is measured through strategies that feminist economists had put forward for a long time, not taking GDP only, but also looking into other measures of well-being. We have to maintain our commitment to those that have the least. The pandemic, more than ever, requires global response based on unity and renewed multilateral cooperation, as I have said, and to care and support a normality where no one is left behind. As feminists, all of us, we know that we not always agree in everything. We take different paths to achieve the same objectives. But I think in this moment, it is very important that we all look forward and build and struggle and commit ourselves to this new normality that in reality is one that is more just. So thank you very much for the opportunity of sharing this action, this idea, these big challenges, and the challenges that this crisis puts forward to countries in our region, and especially in Mexico.
Thank you very much, Nadine Gassman. It's very clear that this is not only a health crisis, it's also a democratic and economic crisis. And I think that Marike Bluefield will continue on that track because she has been invited to give comments from a scholarly point of view. So welcome, Marike Bluefield.
Thank you so much. Thank you. It's such an honor to be here. And I will keep my comments short because I know that there are lots of questions. Let me just say that I'm very honored to be here with three people who have either had such exemplary careers in leadership positions in their countries or are doing so now. And in fact, that's what I'd like to focus on. I'll mention two issues, and then I would like to ask Michelle Bachelet, Margot Wallström, and Nadine Gassman if they have some advice to give to governments concretely on some specific issues as we are experiencing. We are right now in the midst of this crisis, and so we can look at it in the short term, medium term, and long term, but I have some questions related to the short and medium term. And the one thing I've been working on for ECLAC, actually, with my co-author, is the issue of social protection in Latin America. And so my comments center on that. And of course, you know this better than I do, but poverty in Latin America is especially centered in children and women. About half, according to ECLAC's definition, about half of the children in the region live in poverty, and this was before the pandemic, right? And while the elderly are epidemiologically most threatened by COVID, they're also least likely demographically to be in poverty. It's 15% among the elderly, and so where the issue of social protection is particularly important is among families with children. And since the pandemic hit, there has been, among many countries, an effort, a rush to create more social protection for these households that suddenly, I mean, when the informal sector comes to a halt, and all three of the panelists talked about how women are especially overrepresented in the informal sector, and families, household heads with children are especially overrepresented in the informal sector. And when the economies came to a halt in the last couple of months, this affected tremendously families that survive off the labor income in the informal sector. And social protection there, I mean, Latin America has the contributory social security system, which tends to reach the people who are well off, more well off in general already. And then you have a massive extension of non-contributory programs that over the last 20 years have come to reach about 20% of the population, often the most vulnerable population. But then there is a big group of households in between who are not in either program, and those are the households that desperately need protection now as well. And what we see in the region is governments coming to a realization, some governments faster than others, but most of the governments coming to a realization that we need to extend social protection fast. We can, you know, the existing mechanism reach some people, but then there's an entire sector of society, the informal sector, that we have to help. And you see countries extending those policies to, for example, in Chile, the ingreso familiar de emergencia, Argentina has the same there. And these policies for the first time are approaching something close to basic universalism, in the sense that they're actually seeking to include everybody. And I think that this is potentially something very positive, but the governments are facing tremendous challenges in reaching people, especially in countries with lower state capacity. In other cases, the state capacity is there, like in the case of Chile, but well, I would perhaps say somewhat more critically, I would love to hear what Michelle Bachelet thinks about this, but the ingreso familiar de emergencia that the current president has passed into law is not very sufficient, on the other hand. I mean, it helps families, but it's not necessarily sufficient to cover all basic necessities at this time of crisis. So I would like to ask, with this, what concrete advice do you have for governments? Because you either are in or have been in leadership positions, how best to reach these families that desperately need help now? What would you tell them? How should they focus their energies on getting food, medicine, to these families in the most efficient and effective and sufficient way. The second question is a little bit more concrete, but it's also something that every single one of you addressed, which is the pandemic of violence against women. And a lot is being done. Misha, Bachelet, all three of you listed a lot of these measures that are taking place. One thing I have been looking for in Latin America that would strike me as concretely a potential strategy, as governments pass these stimulus packages, they're subsidizing a lot of industries. One of the industries that is most hit is tourism and hotels. Nobody's staying in hotels now, they can't even. Perhaps the government could link subsidizing hotels and at the same time provide all the potential victims of domestic violence, especially women and children, with safe spaces in hotels. I've seen this being done in the European Union by the Spanish government and the Belgian government. I have not yet seen this being done by any Latin American government. Maybe it's going on and it's not visible. What do you think of this idea? Because I think this would be a win-win situation to help people remove themselves in an emergency. This is a short-term solution, obviously not a long-term, but a short-term solution. Remove people from the, the very dangerous conditions they're in, and place them into hotels that are currently empty, while government money is being spent anyhow. So those are the two issues I would like to ask the panelists, and I will leave it at that. Thank you so much again. It's an honor to be here.
Thank you very much, Marike. I would like to start with Margot Wallström. Would you like to speak about the two questions that Marike?
Thank you, Marike. Good questions. I think maybe it's more for Michelle and Nadine to answer exactly what can be done in the Latin American countries. But of course, we have a rather long experience of social protection systems in our country, and I think the debate that has followed the pandemic and of course we are in the middle of it really has to do with the working conditions for especially those women that take care of the elderly, and at these homes for the elderly we have most of the deaths. Yeah. So their protection, their training, their salaries and their work hours and so on, all of this has really been put in the spotlight. So that's one part of the discussion. But we have also taken a closer look at what do our gaps in income, in sort of inequalities, what do they look like today, and what can we do in the future to improve our social protection systems. And this idea of hotels as safe houses, that is already being tried out. I'm not sure if we have exactly the same system in Sweden, but I've seen that hotels are used to help both patients that have been able to come out of hospitals, and I think that this is an excellent idea.
Thank you very much, Margot.
Thank you.
Michelle?
Well, on the last question on hotels, yes, France has started to do that at the beginning, and it worked very well. And of course, if the governments are going to subsidize hotels, that could be a solution, but it's a short-term solution. It's not a long-term solution. I believe for a long-term solution, you need to find places where people can be safe, because it's about saving lives. And shelters is a possibility, because they also give women not only the protection itself, but also the possibility of receiving some training so they can be economically independent, because being economically independent will permit them to have their own choices. Otherwise, they will depend on the family, or they will go back to the husband and so on. So I think we need to think, I mean, while we are thinking on campaigns against violence against women to change the culture, because this is a cultural issue, to consider women as second-class citizens in some way, to give, and I think one of the things that I've thought a lot on gender-based violence, because you see it in any kind of families, I mean, rich ones, poor ones, very educated ones, not educated. So one of the things that I realized working at UN Women, talking to women who were victims of sexual slavery, is that you cannot have intervention that are short-term. Of course, for COVID, okay, you can do this. But how we really are able to address the causes. And one of the things that I found out is that usually in many countries, they do very short-term interventions that don't change the situation dramatically in terms of mental health, if I may say, of the women, of the children, and they don't intervene much on the perpetrator as well. So that they will be, I mean, that woman can divorce that man, but then he will be hurting other women as well. So we learned that the 3 Ps, there was promotion, prevention, and provision of services, and we know what needs to be done. But there's some things that we haven't got it yet, because it's incredible that so much has been written and so on, but still the phenomenon exists. And of course the confinement makes it more possible, but we need to look at it. And I think we need to work much more with the children, because those children who were abused, they might repeat the same model afterwards, or abusing their families as well. So, but I think it's a good idea for the current situation, hotels or whatever places that women can be out of the perpetrator. On the social protection, well, for me this is a so dear issue, because I share the social protection commission on ILO when they started working on this after being president for the first time, and we did a lot of social protection in both of my governments. So Chile is not only under this current situation for COVID, they have a lot of other benefits, people have benefits, but probably one of the issues that will be more complicated, if I guess, is that there are some issues that cover the poor people, the more vulnerable ones, but middle class will become poor, and usually they have a house or they have a car, and probably if you use the instrument that are measuring people, they will be out of the benefits, and that's a real problem usually for middle class. The other thing that it's true that we need to, I mean, it's very difficult, because if it's so devastating, the socioeconomic impact, as IMF, World Bank, ECLAC are estimating, I mean, the amounts of money to really go and support people are enormous. Huh? So we need to think in all kinds of initiatives also to support the possibility of having social protection schemes that can include more people. But one of the problems that we have in Latin America, as in other regions, is that we don't have enough data. I mean, data does not identify. And the other thing is that how could I say, there is an intersection. For example, I mentioned it's not the same to be a professional woman in a rich neighborhood with a big house and so on, that to be a woman that is old, or with disabilities and so on. So we need, and that information we don't have. We have separate information, but we don't have the data that shows all the risk factors. So how we can reach really, not only on the economic point of view, but also on the social, and because of the risky. So that's one thing that I've been discussing with many countries on the SDG agenda without the COVID, is that as some Afro-descendant group, expert group told me that in many countries, they don't identify the people who are Afro-descendant. And they told me, if they don't count us, we don't count. And that happens to many other groups in the society. If you don't count those groups, you are leaving people behind. You're not directing your policies to those groups who needs to receive differentiated policies. The other thing that I would say is we need to have gender lens in all these policies and not neutral, because if it's neutral, it won't reach women, it will reach other people first. So we need to have gender lens. But but I think, and we need to, one person wrote there, we need to fight corruption, because in many places there are some money, but there's corruption, and we need to fight corruption. And of course, we need to work with the international financial institutions to ensure that when they support countries, because they are supporting countries for two things right now. One, they're supporting countries on the health response itself, I mean, to have money, but also on the social and economic impacts. And also the UN is working on a socioeconomic framework to support people. But I believe that, of course, that is to support everyone. But because women are disproportionately impacted, I think we should try to ask all these financial institutions that they should have a gender lens, and that all those projects should take into consideration the situation of women. Of course, the money is to support everyone, but if somebody is disproportionately affected, we cannot give the same to somebody who is not disproportionately affected. So that's some ideas that I can share with you, Marika.
Thank you.
Thank you very much, Nadine.
Thank you, Marika. I think you had put on the table a very important issue regarding social protection. And I think one of the things that the pandemic has shown us that is so important, and it's one of the main areas of work of the National Institute of Women in Mexico, is the importance of the care system. Because the care system allows us to really look into how we create conditions for women to enter the formal economy, and also how it has also a very important impact on security and violence. So I think one of the areas that we need to work more is to really create a system that cares for children, for people with disabilities, for the elderly, where there is a co-responsibility from the family level with support of public policies and commitment of the private sector. I think if we put at the center, if we work on that, and we work thinking that it is good in itself, it creates opportunity, it liberates time for women and responsibilities, which we have seen in this pandemic to become enormous, becoming at the same, working, doing home office at the same time as you are the teacher of your children that are schooling by remotely, and housework. I think everybody has really worked on that. You also create the possibilities of women entering the formal sector, improving the formal social security and all what comes with it, but also, and we're thinking it also as a way to strengthen work on decreasing violence, in general, violence against women. And in terms of the hotels, we are in the process of negotiating an agreement with hotels and Airbnb to have spaces for women that are not at high risk, that do not need a shelter, a proper shelter with all the security measures, but that need time out, that need to get out of that situation. And also something that has been very interesting is that the Ministry of the Interior, which is coordinating the work on violence against women, has issued a request for municipal authorities to strengthen the protection measures for women and to take out the perpetrators from the homes, to leave women and their children at home. I think it's an enormous challenge, and it's something that needs to be done more often. So we take away and take care of the perpetrators and leave women and their children at home. Those are some of the ideas.
Thank you so much for your insightful comments. Thank you. I'll hand it over to Christina. I know there's hundreds of questions, or 88 questions, 89 questions.
Yes, thank you very much for all the questions. Actually, there are more because I received them also in my email. So we have a lot of questions. But I would like to start with one regarding strategies that can help to include and integrate women into the formal sector after this pandemic. What can you recommend? What strategies can we have? What do you say, Margot?
No, everywhere it starts with the right to education for girls, and to make sure that they enjoy the same human rights and legal rights as boys and men. So that's where it starts. And I think you also have to do a particular plans for making sure that women that they get equal pay for equal work, that they're not discriminated against. And still we know from reports from the World Bank that many countries still discriminate against women taking up particular jobs. So it has to start with getting rid of all of these obstacles for women, and I would say training and access to research and the world of research and development as well.
Thank you. Michelle?
Well, I do agree. Of course, I agree with Margot that education for girls is essential, but also trying to expand the areas for women. So it's not only about the caring activities, it's also about science, math, technology, engineering, other areas that usually also have better salaries, because usually women work not only in the informal sector, but even in the formal sector in areas where the salaries are low because they're not very skilled work, and it's paid in a worse way. But also I believe that we should have training places so women can continue developing, and they can start their own SME, for example, small business, and they can give work for other women as well. So we did a lot of those programs, supporting women that they were in the neighborhoods, training them for different things, and so they can start their own project, and also having programs with the National Bank and the State Bank to support with a little capital so they can start doing whatever they wanted to do. Could it be making chocolates to have to be an accountant? So I think we need to think of women as girls, but also on the long cycle, because you can train women that are adults as well, but at the same time you have to enable the conditions so women can do that. So for example, opening more kindergartens, nurseries, so they can leave their children there while they're studying and then working. So I think those are probably the most important thing, because women who are in the informal sector usually is because they don't have other options. So we need to give them other options.
Childcare is key. Unless you have a childcare system, of course, they cannot pick up.
Yeah.
Thank you.
Yeah.
Nadine, do you have?
Yeah, well, so I think on one hand, of course, education and what you just said, the care system, care for children, care for elderly, people for disability is so important. I also think we need to make it easier to become a formal worker. For example, in Mexico, we have 2 million house workers, people that help us, that have allowed us to do all our work. Until very recently, most of them didn't have contracts, social security, etc. So bringing social security and making it mandatory to have, for example, for this category of women workers is very important. On the other side, also, making it easier for small businesses to be part of social security, to be part of the formal system is very important. And I think one way we haven't explored enough or done enough is use the capacity of governments, both local, state, national governments, to really have affirmative actions to buy from women-owned companies. They don't need to be big companies, they can be small, medium, and large, but also to have and say, we will buy 20%, 30%. Nowadays is 1% worldwide. So if we go to 10%, it will be enormous in terms of the capacity of women to really enter the formal economy. And I think, and I totally agree with Michelle Bachelet, we need to think in the long run. We're in a work revolution. We're talking about the work revolution 4.0. And it's an important opportunity to think how we really take this opportunity to bring women in the forefront, to decrease the pay gap, to have them have the best jobs, to convert what they do in what needs to be done. But this is a thinking that requires education, investment, retraining, building the capacity, with this idea that we are in this transition, and that if we don't do something, women will be worse off than we are now, but we also have the opportunity to be better off.
Thank you, Nadine. We have a lot of questions and we will not be able to address them all. But some of the questions are focusing on this, that the restrictions and the lockdowns reduce the democratic spaces we have. And in relation to that, what about the important discussion in Latin America about right to safe and legal abortion? If we start with you, Nadine.
Well, I think this is a discussion that is work that is very present in Latin America, both ways. You know, I was talking about the conservative, and that this is not a time to not think about conservative forces. We have throughout the region very important push towards conservative agenda. We have to push back. In the case of Mexico, we are discussing it, and I was talking about the importance of having a Congress that is paritarian. It doesn't mean that every woman is pro-choice, but we are having the discussion. This year we had another state that decriminalized abortion, and I think it is very high in the women's agenda. As always, it is a discussion that in the region is very important, and there are very important forces that are coming forward with the feminist movement. We have seen in places like Argentina hundreds of thousands of people coming out to ask to make abortion legal. And on the other hand, you have the pushback of very conservative forces. So we are in the we are in the struggle, and I think the pandemic hasn't stopped the discussion nor the demand for safe and legal abortion.
Thank you. Michelle?
Well, I'm a doctor, so I believe that women have to have choices, and according what their own criteria, their own religious belief, their own possibilities, they need to have options. So I think that, and that's why in my country what I pushed for was a decriminalization of the ending of the pregnancy by 3 reasons, because that was what the political parties that belong to my coalition could accept. So that was the first step. Of course, there is a discussion still going on in Latin America, as Nadine was saying, and of course there's a lot of different opinions on this, and of course religion plays a very important role in Latin America on this regard. Even though you have groups of women, they call Catholic pro-choice, for example. You have in Latin America, I think Latin America has had in the last years a very strong development of women's organizations. Ni una más, ni una menos, fighting against gender-based violence. The Me Too, hashtag Me Too also was very important in Latin America. For example, in my country, students, because of some sexual harassment at universities, and they started a movement that not only women, also young people there. So I think this is an issue that is very important for young people, but on the other hand, we have seen that some countries have used as an excuse the COVID-19 pandemic to close or to stop, for example, sexual and health reproductive services for women and for girls. So that's a problem, because UNICEF has considered that there will be a big amount of unintended pregnancy on young girls. and of course women as well. So I think this is a discussion that has not ended in Latin America, but that there is there, and for them it's important.
I advocate for the right for girls and women to decide about their own bodies, and of course the right to abortion is absolutely fundamental, and also to sexual and reproductive health and rights. And as Michelle said, we see that this is now they are experiencing a pushback on these issues in the shadow of the pandemic. So I think that this is very important to look at also from now on. And I see the same with these autocrats, with the leaders, the male leaders that apparently very often start their sort of terms by looking at what can we do to control women and their rights. And this is a very serious phenomenon in today's world. And we women have to come together and fight for their rights. Not to underestimate that it is a difficult issue also from a religious point of view in many countries, but I agree with what has been said, and Michelle is absolutely right that this is something we see in many countries right now.
Thank you very much, Margot. The time is running out, and we have a lot of questions, and these questions are about violence, about democracy, about masculinity, and about work, etc., etc. So we have to continue this conversation another day because there are so many topics that we haven't had time to discuss here. And I think that, or the aim of this webinar is that I think that there is a risk that questions regarding women and women's rights disappear when it's all about health, of course, and about economy. These questions are extremely important, but there is a risk that women's issues are disappearing in this. So I hope that this webinar and that there will be more discussions in the future. And before I give the screen to Andres Rivarola, I just want to thank you so much for giving the time to participate in this webinar and to give the audience a possibility to ask questions as well. So I will give the word or the screen to Andres just to close this webinar.
Well, thank you, Christina, and congratulations to you and David Garcia, that is our communicator at the Department for the organization of this event. And fundamentally, a great honor and fantastic to listen to our prominent and first-rate panel that we have with Nadine, Michelle, and Margot. And of course, the questions and comments from Merike Bluefield from Hamburg. It is the wish and the commitment of this Nordic Institute of Latin American Studies here at Stockholm University, in cooperation with the Nordic colleagues and Nordic universities, to have this topic, the topic of women in Latin America, of gender issue, as a central part of our research and our teaching agenda. Actually, when we inaugurated the Institute for some months ago, we had Merike as a keynote speaker here at Aula Magna at the university, together with the group of performance activists and feminist women from Chile, Las Tesis, that did their performance here at Stockholm University, and they then also have the possibility to present their work and their ideas. So it was really a fantastic thing. And we definitely will continue to do that, because we really believe that it's our role as universities to connect you, international organizations, politicians, officers, with academic, and to continue building on this issue, to try to improve our societies. So thank you for participating. thank you for our hundreds of listeners out there. And I hope those of you that haven't listened to this can take part of this later on through our homepage. So, muchas gracias. Tack så mycket. And thank you very much for participating. Goodbye,
Muchas
everybody.
gracias. Thank you to you. Thank you.
Bye-bye.
Take care.
Gracias.
Bye bye.